Hi, Catherine.
Are you here?
I am here. Good to see you.
So good to see you. It's been forever. Wow. Well, thank you so much for joining us. I'm super excited. Are you Tyler
Tyler
Morris,
I'm
who is the
here.
CEO of the Wellbeing Trust, and he's here today to talk to us about cancer, mental, social, and spiritual health. Thank you so much for joining us. I'm super echoing.
I think it's better now.
Perfect. All right, so thank you for joining. Yeah, and I'm gonna hand it right over to you.
Well, first of all, thank you so much for having me here, and so good to be with people from around the world, and have been sandwiched between two of my most extraordinary allies. One, Maitreyi, who I find one of the most thoughtful systems leaders globally, helping think about how do we change things at a system level, and Sharon Salzberg, who's a profound teacher. I want to greet everyone from the Sawtooth Mountains of central Idaho, where I recently moved back to the lands of my childhood. These lands, though, being the unceded and occupied lands of the Shoshone and Bannock and Nez Perce and Paiute people. But in honoring this rich multi-day experience that's before us here on the sources and the sustainers of true happiness and well-being, really a celebration of life and living. And before I talk about my roles as the CEO of a leading mental health foundation trying to advance a social movement in the United States, or my role as the chair of Naropa University, where we're helping engage and activate the artists and healers and activists of the future rooted in loving kindness and mindfulness. I want to speak from my own experience, my own journey up the headwaters of how do I find well-being, and how do I build my resilience, and how do I work with my anxieties and my depressions and my thoughts. As a child, I had the opportunity here in Idaho to be what we might call a free-range kid, immersed in nature as a way of living, as the basis for living, as part of who we were as a family and an economy, not just a place to visit or a place to go as nature. Of course, visiting nature is an extraordinary place when one has an open heart to allow the land to speak to us, to reveal our own nature back to us about who we are and how do we interact with greater forces around us, to in a way remember, literally that word, to remember, reconnect us into who we are. And so as a kid, nature became my first and most profound therapist. I also, growing up in rural Idaho, had the chance to experience tribal community. And the indigenous communities where I were more rooted, frankly, than my own Anglo culture, my own white culture. They were much more rooted in mutuality and co-identity with nature, co-identity with each other, not somehow separate from us. And when I was invited to experience a potlatch ceremony, potlatch means giving, sort of in shorthand, I witnessed a world that celebrates belonging, right? So no matter who you were, how out you might have been, you're always in the community. That was my experience, even with the teasing, and it was in and in. And that the notions of wealth or what community was about wasn't measured by net worth, but rather by a combination of spiritual qualities, if you will, by one's behavior as well as material goods. And in fact, leaders were selected for their ability to take care of the tribe by sharing their wisdom as wealth, identity in community, not identity in separate self, value of being human in community. There's so much as we think about what our First Nations and Indigenous brothers and sisters have to teach us about resilience. And I'd like here again to evoke the word respect. Respect, to look again at what those knowledge and gifts are of a culture that celebrates us and where we can be engaged. Catherine, as you know, it took me about 50 years to move back to my hometown. One of the reasons is that I left as soon as I could after graduating from high school, both to pursue a future out of a small town without many jobs, but also, frankly, to get past my shame. Because at age 14, as a kid with a friend, fueled by alcohol and a growing addiction and losing our way, and frankly, a community that was a bit asleep at the switch at that period, we went on a bit of a daily rampage on a Mother's Day, just to put it in context, and did damage to our school and to the community. About 3 weeks later, what today would have been a felony. About 3 weeks later, there's a community meeting. We're a small rural town. It was just horrifying with my friend David and I and our parents. And I remember the principal of the school and the judge and the police chief in the front of the room. Any kids that would do this to this school, Sam Hazard went on, needs this school, needs this community. David and I were like, and community saved my life that day because we were given a plan for restitution and reconciliation and a way to heal in our community. A way to do today as white kids in a rural community, or my other home in Oakland, California, black and brown kids, we call that diversion. And it doesn't happen like that. And it shouldn't be that a privileged white kid in a rural community should get that, when in fact, by the grace of Judge Alban and our teachers that day, here I am before you leading the leading mental health foundation in the country. So I went on from that to really focus on how to build healing rooted in community. My early 20s, about 7 years later than that scene of the crime, I helped start something called Step Denver that was rooted in community to help men and women at times stay sober and go to work every day. Remember the day we were eyeing an old A&P supermarket across the street that was vacant, and we went to Disabled American Veterans and convinced them, we had all these veterans, and we convinced them to give us the building for 10 years if we could renovate it. It was like 30,000 square feet. It was sort of impossible. I remember they said yes. We walked out of the meeting and we went, oh my God, how are we going to do this? And there was an AE meeting going on, and we were kind of overhearing this. And one of the guys said, we don't even have a blanket plumber. And one of the guys stood up and said, well, I'm a blanket plumber. And a guy stood up next to him and said, well, I'm a blanket electrician, and my electrical company used to be one of the leading ones in Denver. And we found that every skill set we needed to refurbish that building was in the program. And it changed my perspective of where assets lay and where gift lay and what it means to be tempered by fire through recovery, through healing, with community as our guide. So shifting hats for a moment, fast forwarding some decades, leading a philanthropy focused on how do we measurably improve mental health, reduce addiction, and reduce deaths from anxiety, depression, and suicide, from alcohol, opioids, and suicide. I turn to our kids and say, well, what should it be? And in fact, my kids asked me, what are you in fact doing? So with Wellbeing Trust, founded by the Providence Health System about 5 years ago, we are focused on saving 100,000 lives from the deaths of despair. And I know, Catherine, you've talked about that as not only hopelessness and helpfulness, as we talked about at Step Denver a little bit earlier, but how do you build a social movement? So building on the data of doubling every decade rates of deaths of despair, and that expected to double again in the next decade, and maybe over 80,000 US deaths just in the past decade due to the fallout from COVID. We knew we needed to take a systems approach. In fact, this is the data from Robert Graham Center that illustrates that expected deaths of perhaps about another 80,000 lives. And then if we think more deeply, and I go back to my own experience where shame and taboos and secrecy sort of kept me from evolution. I didn't even tell that story until I was well into my 50s, frankly, so shamed by my early childhood that I think about those adverse child events and adverse community experiences and the way we self-medicate. No wonder we do all this, because we've got to open the safety to talk about who we are and what we're experiencing, the honesty of our feelings, and frankly, the ability to be human. So we have a systemic approach to address the individual factors, systemic factors, social factors, just as Moitrey was so beautifully describing earlier. And that's really where we come from. Yes, we have to change policies and practices and flows of resources, right? Organizational practices, public policies, and investment capital. And we need to build relationships to do it. But how are we thinking about dose-sufficient change that isn't tinkering around the margin, but in fact is capable of saving lives? So our focus, get the care right, increase access to care, and create the conditions for well-being in the first place. Those of you who are interested in the consensus US framework for what many of the leading mental health, addiction, and well-being organizations are using, here it is. The framework for excellence. It's rooted in 3 parts: community, coverage, and care. The vital conditions for well-being. Historically, these have been called the social determinants of health. 40 years later, I think we can upgrade the language. These are the conditions that everyone needs to be able to flourish, right? So that communities can be gardens to grow people in. Last year, working with the CDC Foundation, we crowdsourced over 100 brilliant multi-solvers that are concurrently renewing civic life, economic life, and the social emotional well-being of people. I encourage you to go to thriving.org to learn more about those multi-solver strategies in communities. We worked with the de Beaumont Foundation last year to help build strategies of what can communities do with their parks, with workforce, in treatment modalities to actually address mental health issues in a systemic way in the times of COVID. Wellbeing Trust has helped shape some of the funds that have been allocated, the $9 billion as part of the 1.9 million stimulus strategy, with our partners through Healing the Nation, which brings that forward. And in fact, back to that, also California SB 855 that increased access to mental health and addiction care for 13.5 million Californians last November. Governor Newsom signed into law, may save an additional 20,000 lives. And no wrong door. Wherever you are, access to integrated whole person care with the assessment and referral to non-medical needs. One of my favorites is Be Well Orange County in Orange County, California. Crisis stabilization unit at the center, but it's really a wellness hub that connects it to food security and housing and therapy and community and peer groups of all forms, really expanding what is a clinical community ecosystem. So it's not just about the prescribers and how do we build more professionals, as important as that is. And then most importantly, what our work has been is we reverse engineered social movement theory on the last social movements from environment to suffrage to marriage equality to civil rights and identify these 7 areas. And partnering with the folks that you see on the right, we help build mindful philanthropy to bring more money into the mental health field and focus it on what works. We helped launch Inseparable to be the first 501c4 in the US to really take the gloves off and advocate for mental health policy at the state and federal level. And other linkages like with Active Minds and Young Invincibles and others to help build this national movement. So I'm going to close and turn back to you, Catherine, with kind of, for me, what is a koan, which is what does it really take to secure a legacy? Back to those kids facing us in that earlier piece. What does it take to secure a legacy of intergenerational well-being for all, where we affirm the inclusion of people for who they are, or we inflict trauma and exclusion, where we are stewards of our responsibilities, and when we ensure that not only access to mental health and addiction care, but access to the vital conditions for well-being are essential to ensuring that we can create human flourishing for all and communities as gardens to grow people in. And with that, I'll stop. Thank you. You're on mute. You might be on mute.
Thank you.
There you are.
It's the first time I've done that. But thank you so much. I always love to hear you talk, and I get so much out of it every time. So I appreciate it so much. The one key for me thing in your talk, and just something that really stood out to me, is just, well, first the connection, but the safety. Like how we have to feel safe as humans. And I think if COVID has done anything, it's made us feel unsafe on so many different levels, and you know, with the chaos and confusion and leadership, and just there's so much about it, and it's our basic fundamental human need. which you touched on, and is I think it's really important that we address that and talk about it, and like you said, create these spaces of safety for connection. So it's always, I'm so grateful that we got you on today and learn more about your work. You have been a leader in the space. Well-being, trust, and safety is all about trust too. So thank you for joining us today.
I appreciate you bringing up to safety. I think safety is base camp, whether it's safety in our communities and environment and going to our schools, or the safety to be who we are, LGBTQI, to be someone who struggles with addiction, to be someone who's sad, is the beginning of healing. As a chaplain, I know that the most important thing I can do is to create a safe space. So let's all do that.
Yeah.
We can all do that. We can all do that every day by just opening our heart.
Absolutely. Well, thank you so much for joining us today. Great to see you.
Thank you, Catherine. Blessings. Look forward to the next session. Take care.
Thanks.